Start soon.
Welcome to the Holistic Kid Show. My name is Zane.
My name is Abdullah.
And my name's Imad.
We're the Holistic Kids here to educate us kids from the inside out. We're at our 4-year anniversary of the Holistic Kids. Yeah, 4 years. And we've talked a lot about the effects of the gut microbiome and our health. But did you know that there's also a microbiome in our mouth?
Really? I thought there was only one digestive tract.
Imad, where does the digestive tract actually start?
In our mouths, we have to eat the food and then chew it.
Actually, it's the second most diverse microbial community in your body, with over 700 species of bacteria that colonize the teeth and oral mucosa. The oral microbiome plays an important role in our health by interacting with the immune system. But in today's world, our lifestyles are disrupting our microbiome and our oral microbiome. So how does our mouth health, how does your mouth health affect our bodies?
You guys are
today-
hired. You are totally hired. You can introduce all of my podcasts and Instagram posts. It's amazing.
It's our pleasure.
It's our
My
pleasure.
pleasure.
And that is why we need to have the one and only Mr. B here to help us understand just that. Dr. Mark Burhenne has dedicated his career to helping people connect oral health to bodily health. His concern is that dental education focuses solely on teeth. But as soon as you spend one day in real-world clinical practice, you learn that patients with poor dental health have a host of other systemic clinical symptoms. I mean, he's also a best-selling author, a TEDx speaker, and also appears on CNN, NPR, the Huffington Post, Prevention, Men's Health, CBS, and even Mind Body Green. He is also the creator of Ask the Dentist and is also dedicated to exploring the mouth-body connection in overall health. So thank you so much for joining us today.
Thank you for having me, and thanks for the intro. That was wonderful.
We haven't talked to that many dentists that really think about the whole body.
We would love to know your story.
Thank you. I wouldn't feel bad because dentists don't get included in the discussion that often when it comes to full body health, but the three of you already know that, and thank you. My story, oh gosh, my dad is a physician. He was a world-renowned radiologist, and I was kind of always interested in medicine, but I didn't want to do what he was doing. It would have been very difficult to fill his shoes. So I kind of drifted along in school, in college for a while. I was a history of art major. I was comparing Gothic cathedrals to each other and writing kind of a thesis on how one really was the prototypical Gothic structure over the other, and doing all that. And one day I took a personality test. Now, this is before we had the internet. I went down into the basement of the library, and there was an old CPM machine with floppy drives, and it was a questionnaire that was tied to kind of personality profiles. And the number 2 option was dentistry, and it really caught me by surprise. And so I liked what I read about it. There was some autonomy, more so than in medicine. You could run your own business. At the time, I didn't know about all the possibilities in dentistry, but I kind of doubled down at that point, had to kind of catch up and do a lot of pre-med and pre-dent classes in college. And then I applied to dental school and became a dentist, and received the classical traditional curriculum training for healthcare professionals. And then later in my career, modified all that based on what I was finding clinically, and realizing that not everything I learned in school was working well and applicable to what my patients needed. And that's where that whole functional approach came. And that's where the realization that what happened in the mouth was actually part of what was happening to their joints, their heart, their brains, even their mental capabilities, mental state, sense of well-being. All of that was connected. And so from day one, it was absolutely fascinating. Even in dental school, just how do you do a filling? How do you do a crown? How do you restore that? Broken tooth, how do you fix that? To, how do you connect gum disease to someone who has Alzheimer's? I mean, so it kind of started slowly, history of art and not wanting to be a physician to ending up being a functional dentist, and now even crazier, an oral health care influencer, and that's a whole different, an educator. And of course, that's because of the internet that has democratized healthcare. And I definitely caught on to that very early on and rode that wave. And that's why we're here talking. It's wonderful.
Well, that's amazing.
It is amazing.
And especially it's so amazing to have a dentist on this podcast, because most kids, they're scared of dentists. I know I was. I know they're probably still a little bit.
Yeah.
So it's amazing to learn about the teeth in a way that we've never thought about it before. So, Ahmad,
How is it going?
Like, we're told to brush our teeth twice a day, floss regularly, and use mouthwash. Why is it so important to take care of our teeth? And
go ahead.
And how is it going on in our mouth connected to our body, your body? Right.
Okay. A lot of questions there. Let's start with just the first question. Why bother taking care of your teeth? And actually, that's a really good question, because a lot of people don't think it's that important. It's just the mouth. If you don't take care of it, what's the worst that could happen, right? Their teeth, they're hard tissues, they're inanimate. We eat with them. And they'll last forever. All of that is wishful thinking and kind of dangerous thinking. The mouth is way more than that. Of course, I'll connect that to the rest of the body, but the mouth needs maintenance. It needs help. Now, in the old days, our ancestors, they really didn't know about the germ theory and about bugs and the biomes and why cavities occurred, because they rarely experienced cavities. At worst, our ancestors would be hit in the mouth or fall, or an animal would kick them and they would lose a tooth. It would become infected. It would cause them a lot of pain. And occasionally they would die from a tooth infection. They had no antibiotics. But that was kind of the extent of what they were experiencing. And that was very uncommon. And I think most people at any age, they protect their mouth. They protect it because it's the airway, it's the opening to the being able to breathe. If someone covers your mouth, you're going to push back and fight. There's a lot of sympathetic kind of, what's a better word for sympathetic? Kind of that fight or flight kind of feelings connected with protecting the mouth. But what happened is we now in the current modern age is we have breakfast cereals, we have crackers, we have candies, we have processed foods. I even hesitate using the word food. We have these processed particles in bags that we call food, that we refer to as food, and that has
fake food.
No, we just call them fake food.
Yeah, fake food. Exactly. Perfect. Fake food. And artificial food. And that has made it even more imperative and more necessary for us to floss and brush and scrape our tongue and all that and be concerned. So what are the basics? The basics are, when you eat those foods, the biofilm, the plaque layer, that's a layer of bacteria and kind of proteoglycans. They're like proteins. It's a skin. In fact, in the old days, we used to call it a pellicle. It's a skin of the tooth. And as soon as the tooth erupts, when you're a kid and the tooth erupts through the gum, it's covered by this skin. And that skin is designed to cover that tooth. And with it comes a layer of bacteria. And those bacteria help remineralize the tooth, prevents decay from happening, protects it from acidic moments. When you eat all this junk food, there are a lot of acids in the mouth. Acid, of course, can dissolve a calcium object, something made out of calcium. So it's there to help us. But when you feed it all this fake food, it gets very thick. It becomes very malicious and dangerous, and it turns on the tooth and dissolves it over time. And it can also cause a lot of inflammation of the gums, which leads to gum disease, which can lead to other diseases in the body. So unfortunately, in today's world, we need more maintenance. We need to floss. That's getting string in between the teeth. And it's not removing anything. It's breaking apart that biofilm, that plaque layer, that pellicle, that skin that I was referring to. And it prevents it from getting all furry. And then, of course, brushing keeps it off of the tooth. And I don't know if all three of you have noticed that when you eat something, and occasionally we do this, we eat something that's not good for us, but you'll kind of get a furry feeling. Let's say you eat some cookies or some goldfish crackers. Afterwards, well, not to mention what happens to your body, right? I mean, your pancreas is
You
screaming.
could go an entire hour on what happens to your body.
Exactly. Your blood sugar levels go up. I mean, you start experiencing a lot of overall inflammation that directs back to the gums. It's a bidirectional phenomena and has bidirectional effects. But essentially, when you eat that kind of food, most people, if they're really paying attention, and again, we get used to this, so we don't notice it. That biofilm thickens and it gets furry. And so for a lot of my younger patients, I will tell them, do you want a really clean, smooth feeling when you run your tongue over the teeth, or do you want something kind of furry? And most will say, oh, I don't want furry. Furry is disgusting, and it means there's something on it. And that's the feeling you get after you brush your teeth. You go from a furry feeling, kind of something like there's something on your teeth, to something very smooth and clean. Also, your teeth look brighter, they look cleaner, they have higher reflectivity, they look shinier, and so you have a nicer smile, and things don't smell as bad. And obviously, you don't get dental disease as much. So we live in a world where we do have to floss and brush. Our ancestors, I mean, they were eating complex carbs, raw vegetables, probably raw meat, then cooked meat. I mean, it was a diet that really didn't cause that furriness and that buildup of biofilm. So, did I answer that question for you?
Yeah.
Okay. Why floss and brush? Yeah, it's we have no choice. We have to do it. I have a few patients out of tens of thousands of patients. I probably, in the 36 years I practiced, I probably had 10 or 12 patients that literally didn't brush, didn't floss, didn't need a cleaning every 6 months. They had beautiful teeth. They were whiter than the average tooth. They had just wonderful oral health. Of course, they ate a very simple whole foods diet, no breads, barely any carbs. If it was a carb, it'd be like a Japanese yam or something like that. So, and it would be cooked properly. And anyway, so that just doesn't happen anymore, unfortunately. So make sure you
definitely
brushing and a good toothpaste. Yep.
You definitely do not see people eating Japanese yam being a part of their diet.
They're hard to find. We have them here in Napa Valley, and they're delicious. And then, of course, you have to cook them properly and make sure you keep the nutrition in it. You don't want to overcook it. Prepare foods properly. Anyway, yeah, it's a necessary evil of today's life and existence. We need to brush and floss. We need to have an oral hygiene program, and we have to be diligent. And even missing one session of brushing and flossing can lead to bigger buildup of this biofilm, that burden, this toxic burden on the teeth. And it's hard to come back from that. And that's why we go see a dentist every 6 months or every 3 months for some people. We need a professional to scrape it off and to remove it and to look at it and measure it.
So one thing I want to touch on is something that we've talked a lot about when it comes to affecting the body, which is sugary drinks like Coke and Fanta and Sprite and Dr. Pepper and all of these brands. We talk about how they affect your gut microbiome. We talk about how they affect your brain, even how they affect every part of your body. But we also know that sugary drinks, especially when we're researching for the book, that they affect the teeth a lot. So could you tell us more about that?
Yeah. So anything that has glucose in it, even more dangerous, fructose, sucrose. These are, simple short chain sugars, carbohydrates. They are a man-made product. They are highly refined. I think a lot of people think sugar is just something we pick off of a tree or off a plant. Yes, it is from the sugarcane plant. I actually knew a tribe that lived in Nigeria that chewed on sugarcane as their chewing stick. That was in central Nigeria. And they did fine. It wasn't too bad. But sugar is a refined product, highly refined, bleached, broken down, highly refined product. And that has just raised the glycemic index. That has made it more dangerous, more processed, of course, leads to the ability for the bacteria in the oral microbiome. These are bugs that are in your mouth, just like the gut microbiome, a lot of bugs. They consume that sugar, and the byproduct, they're the byproduct of that metabolism of the bugs digesting that sugar, which essentially is their excrement. I mean, is a highly acidic, a low pH product, something that's very acidic. pHs of down to 1.5, 2, pH of 2.
Oh, wow.
That literally, it creates a lot of havoc in the mouth and can dissolve tooth structure. Now, unfortunately, a lot of these drinks that you just referred to, not only are they high in sugar, and so when the bacteria consume that sugar, produce their own acids, that's the first acid attack. A lot of those drinks are acidic in themselves. In other words, if you were to measure the pH, and I do recommend that you and your friends and family and anyone else you want to talk about this with, is go on Amazon, buy some litmus paper, and start measuring the pH of everything that you eat and drink. And you will be shocked to see that even some mineral waters are on the acidic side of the pH scale. Now, obviously, like a Mountain Dew soda, I mean, it's below 2. It's almost like painting your teeth with acid. So secondarily, these drinks are just acidic in nature to begin with.
Yeah, they're basically poison.
Yeah.
Fake
Poison for your
drinks, fake
entire
food.
body, your teeth, your gut.
Yeah.
You're right.
How is what is going on in your mouth connected to your body?
That is a great question. That is a big question. Let me try and simplify that. So, obviously, the mouth is in the body. In other words, it's part of the body. It's connected to the body, right?
Obviously.
Yeah, but like,
I think a lot of people are kind of thinking, no, it's a separate part of the body. How could that be? Obviously, because it's it's connected, integrally connected to the body, and it's the opening of the intestines and the intestinal lining and tube and all that. So to think that it's something different is very disturbing, but that's really the way we think of it, unfortunately, in modern. But there are, okay, in a nutshell, if you get disease in the mouth, if you have what we call a dysbiosis, means the oral microbiome is failing. Let's say you have cavities, or you have gum disease, or you have another infection in the mouth. That infection doesn't stay in the mouth. It can travel to other parts of the body. So it can get absorbed through the cheeks, through the gums. If the gums are bleeding and inflamed, if when you brush your teeth or floss, you see a little blood on the floss or in the sink, as Dr. Stacy says, pink in the sink. That was the other dentist you interviewed. That essentially means that there's a permeability. There's a kind of a leaky nature to the mouth. And so these bad bugs that are causing the infection can go to the brain, can go to the heart, can go to the pancreas, can go to breast tissue. It can cause cancer. It can cause Alzheimer's. It can cause inflammation. It can seed inflammation. It can aggravate inflammation. It can mess with your ability to deal with high sugar moments, with insulin resistance and all that. It can cause joint pain, inflammation in the joints. I mean, so out of the 10 major diseases, inflammatory chronic diseases in the body, about 6 or 7 of them are connected in some way, or in those diseases you will find the presence of a bug from the mouth. And the bugs in the mouth are pretty unique. So when they show up in the brain or in your joints, it's like, aha, that wasn't there before in a healthy state. It came from the mouth through the bloodstream. There are other ways of getting there, of course, but that's the major route. That's the connection. It is a physical connection, and it's always happening. And the body is always fighting off those bugs from the mouth, and the bugs in the mouth are always trying to modulate and behave themselves so that they don't become malicious and mean and nasty and infectious and all that. And when they do, they will travel throughout the body. I mean, it makes sense, right? Why would they stop in the body? Why wouldn't they spread elsewhere? I mean, you can get an infection in your finger, under your nail bed, it becomes very infected. And what does it do? It travels to other parts of the body. It can create sepsis. And so why we think the mouth is walled off and a separate system is just incomprehensible.
I guess most people just don't want to think about the mouth because that means that they have to control what they're putting inside the mouth.
Right.
And let's just say that going to school, we know that most people don't want to think about what they put into their mouth.
Right.
Right,
I agree.
Mike?
I mean, I think they think of the mouth as just as an opening.
Yeah,
It's way more than that. There's a lot behind the mouth. There's a lot going on in there because it is the largest opening in the body. There's a lot of behind the scenes work that has to go on in terms of defending it and protecting it. The nose would be the second largest aperture or opening. All the other orifices are closed and will open occasionally, but the mouth is open all day long. I mean, look at us. We're all talking and the mouth is open and we're breathing in things. We're taking in things when we eat things. The mouth, the tongue and the nasal passages, it's sampling the environment. It's checking for toxins and poisons, and it's smelling. It's, if there's a predator nearby. I mean, our ancestors had incredible olfactory capabilities, which we've kind of lost over time.
Oh, you are so empowering.
So empowering.
Oh, good. Thank you. Thank you.
So how do we take care of the bugs in our mouth?
Not
And
like ants.
And the what?
like dirt.
Like not
Some
bugs,
people-
but the microbiome.
Oh, the bacteria. Oh, okay. Right. Okay. Iman said something. I didn't catch it. So the bugs. Okay. I mean, they are bugs. They're bacterium. There are viruses. There are yeast cells and fungi cells in the oral microbiome. The oral microbiome is slightly different than other biomes, and that's pretty obvious because this mouth is a very hostile environment. You've got a lot of dry air coming in. You've got a lot of foods. You've got a lot of oral care products that shouldn't be there. I mean, you can't brush your villi and your intestines, thank goodness, with toothpaste. That would take out the stomach, right? But you can do that in your mouth, which is insane because we're right at the opening. So, the best way, I'm trying to keep this very insightful and simple. The oral microbiome, the best way to take care of the oral microbiome is to leave it alone. Let it do its job. And we've been doing the exact opposite. We've been using products that are designed to disinfect the mouth. Detergents, soaps, pesticides, triclosan, propylene glycol, essential oils. These all have bactericidal mechanisms of. A lot of them are added to allow the toothpaste and the product to remain shelf stable and give it some shelf stability. But that's a little industry secret. But they add the essential oils because it makes it look very exotic, and then you smell like the essential oils. And no. It actually makes your breath smell worse. So to sum it all up, let's feed the oral microbiome what it needs. The good bugs need fiber. They need prebiotics like chicory root. My favorite salad, and I love this, I'm almost half Italian, is the tricolore salad. That is, it could be frisee, it could be arugula, it could be endive, and then radicchio. And the reason they call it the tricolor, the three-color salad, is because it has three different colors. You put some olive oil on there, a little fresh cracked pepper, no salt, because it is already bitter. That is the most amazing thing you can do for your oral microbiome. Fermented beans, natto, that has a lot of K2 in it. These foods will make your oral microbiome, it'll give it superpowers, and it'll allow the oral microbiome to prevent cavities, for your whole life. You potentially could never get a cavity if you eat well, and no gum disease in your life as well. And remember, 70% of us have gum disease after a certain age, after age 60. Almost half of us have gum disease after age 28, 29. It's a pretty prevalent disease. Cavities are the #1 disease in the world right now. I mean, it's not a killer, but it is the #1 disease in the world. but it is indicative of an oral microbiome dysbiosis, which could lead to heart disease, which is the #1 killer, at least here in the US. So cardiovascular disease. So it's all tied in with that. So leave the oral microbiome alone and give it what it needs. Don't try and manipulate it and disinfect it and over clean it and be overzealous. That is the best way. That's the best advice I can give you. And that means buying the right products. I mean, 90% of the products out there, I would say 98% of the products out there, do exactly what I just said. They do the opposite of what they should be doing. And they actually cause high blood pressure, for example, and a dysbiosis of the oral microbiome, diseases in the mouth. So leave the oral microbiome alone and give it what it needs. Just good food. Feed the good guys.
Yeah, I used to have a ton of cavities when I was younger, and then I changed my diet. I actually didn't use take care of my mouth back then, and we also changed our toothpaste. And I made it at home. It wasn't as it didn't as feel as good, but it was definitely healthier.
Yeah, I think one of them we used black charcoal. I remember that was when we tried. That was back when we used to eat toothpaste a little bit because we were used to the tasty toothpaste, toothpaste, and then our mom switched to black charcoal. I remember thinking, oh, let me try this. Put the charcoal, the toothpaste, try to eat it. It's like the entire tongue turns black.
And then you look in the mirror and your teeth are all black. That's
yeah, exactly.
Yeah.
That's not great gratification or positive or reinforcement for brushing. But the DIY recipes, we have a lot of them on our website. That's a great place to start. It's fun to be able to make that. The problem is it takes a lot of work. And also it doesn't have a long shelf life. It has coconut oil in it and has other things. Those are very popular posts for us. People really like to make their own toothpaste, but you can only make it in small batches. And let's face it, in our modern lives, we don't have time to cook. Well, I shouldn't say that. We do have time, but we don't think we have time to cook and do everything from scratch and use the right products and make sure that we stay away from these mainstream products. So, but yeah, I'm sorry, Zane, that you had those cavities, but at least you understand that there's a connection. I mean, there's a reason. I think most parents, and they pass this on to their kids, and I think most kids as they grow up, they're like, dentist, oh, I'm going to get a cavity. They just connect the two together. It's like a rite of passage. They just assume that they're going to get a cavity, and that we should get out of that way of thinking. I mean, we don't need to have cavities. That's not a given. It is not a given. You can grow up. I have my daughters, for example. I know a lot of patients that have never had a cavity, and they're all adults now. So it is possible, but you need to know what you're doing. You have to eat properly, and you can eat something that's cavity causing occasionally. But if you eat it every day, and especially if you snack on it over the day, it's not necessarily, in dentistry, it's not the quantity, it's the frequency. In medicine, it's the quantity. So if you eat like a big chocolate cake all at once, that's not good for you. But if you eat the chocolate cake all day long and take little snacks, that's going to cause a cavity because the tooth cannot fix itself. It's always demineralizing. It's always losing calcium. It's always in that low pH state or that acid attack, and it can never recover. So anyway.
So you're very knowledgeable, in people in teeth, and you're very empowering and inspiring. So on your journey to you also probably how to fix your own teeth as well, right?
Oh yeah, you're right.
So what is your top like 2 tips that you?
Tips.
So what is your top 2 tips that you learned that you would like to share with us?
Right. Okay. Well, diet. I mean, I'm like Zane. I had cavities as a kid, and I didn't eat well, and I don't think my parents really understood, even though one of them was a healthcare practitioner. I mean, I grew up at the beginning of the big breakfast cereal revolution, quote unquote revolution, right? And sugar was right, and de-evolution, more like it. But it's I don't know. I think my regret, and again, I was a child. I can't blame myself for that. But my diet was what caused me to have cavities. And my last cavity, which was about 28, 29 years ago, I was an adult and I was a dentist. I know exactly what caused it. I know exactly what caused it. So it is cause and effect. Clearly, you can prevent it, and you have the power. You can empower a patient as a dental provider, as a hygienist, as a dental assistant, as a dentist. You can give your patient the power not to have any dental disease, and we have that knowledge. So that would be my first tip: eat well. And if you don't eat well, obviously don't do it often enough where you would cause any problems, and clean up, make sure you're brushing well. I guess my other tip would be, and again, being a stupid dentist, right? Being taught dentistry 101, there are a lot of problems with that. It's not a perfect education. It's kind of old fashioned. It's 20 years behind the time. Although they do produce, the dental education is amazing. They do produce very good clinicians, which we need. When you've got a problem in your mouth, you need someone who's good with their hands and knows what to do. So I think what I'm trying to say is that learning the functional approach and learning that there are other things that you don't learn in school. And I think that the big thing would be learning to choose the right oral care products. And early on in my career, now I was never for fluoride. For some reason, even before dental school, I was against that. And that's a long story, and I didn't have the data that I do now. And I raised my daughters without fluoride, and that was without hard data. And that was the right thing to do, because now we have the data. But even back as a dentist, I was told, this toothpaste works well, and, use floss and brush with an electric toothbrush. And that all made sense. But then as you get deep into the products, you realize that the toothpaste and the mouthwash, probably because they're disinfecting the mouth, are actually causing more problems and not preventing what you would think, what you're being told. So I think my choice in dental products could have evolved quicker, perhaps. Again, I was against fluoride, which was good. I was raised on fluoride, unfortunately, because it was in the water in San Francisco. I was drinking it. But I wished I had realized earlier in my career that a lot of these products were an absolute mess. Actually, the opposite of what, and again, this is 100 years of using the same products over and over, and the profession accepting and promoting them. I wish I had seen that writing on the wall that this is not right, but I didn't have all the facts. And until the data on the oral microbiome came along, it was when I realized that the oral microbiome, and this was 2003, 2004. Once you know everything to know everything we know about the oral microbiome, which is not enough, then you realize, oh, okay, this makes sense now. We are using the wrong products. It's the wrong approach, because the ingredients are not what the oral microbiome needs. We need to feed the good guys. We need to leave them alone, let them thrive, don't get in their way, and let them do their job. And I wish I had seen, personally for me, that would have meant less dental care if I had known that as a younger person. But I'm not to blame myself. So
those are amazing tips that we'll be using in our life as well.
So we would love to know about your toothpaste.
Oh, my toothpaste. Thank you. So it's been on the market for about 6-7 months. Shocking at how well it's selling. We were not ready for the reception, but we're back in stock. It is exactly what we discussed. So I have 2 business partners. I have my daughter and Dr. Stacy, who, again, well. The 3 of us finally got together and said, we had listened, and Dr. Stacy and I have been talking about what not to use. And I think we were kind of waiting for someone to fix that, and nobody was fixing it. So we finally looked at each other, the 3 of us. Actually, I think it was Catherine, my daughter, and she said, make a toothpaste. Just make it. Stop talking about what it should be. Just make it, right? Well, just making toothpaste is not an easy thing to do. And it took us 2 years, but we came up with our toothpaste. Here it is. Feed your good guys, right? Fig. And it's been a lot of fun. It's been a lot of work, but very satisfying, because it's exactly what Dr. Stacy and I have been talking about I've been talking about it for 20 plus years.
20 years? Wow.
Yeah. And,
Wow.
and my thing was emulsifiers and surfactants, obviously no fluoride. That goes back 50 years. Obviously, we took out all the other things that would come and go, like triclosan and propylene glycol and all these chemicals. And then, of course, adding prebiotics and L-arginine. That was something that Dr. Stacy was very keen on. She sees a lot of children, of course. I mean, we wanted to produce and manufacture and make available to the market and give people choices and unhinge the oral care market or that category of toothpaste. We wanted to make some big changes and flip everything on its side and make people realize that everything they're using is not good, and you should really be just getting out of the way of the oral microbiome and giving it what it needs. And that is where the name came from. My daughter actually came up with that name, Feed Your Good Guys, FIG. And that's what it's all about. It does not have fluoride in it. Fluoride is topically, when you just put it in toothpaste, is a good remineralizing agent. In other words, it does make the teeth stronger and harder, but it does it in a very artificial way. It combines with calcium and creates this other apatite crystal called fluorapatite. But my big, and it works. My pet peeve with that, though, is that fluoride also gets into the bloodstream. And for a pregnant woman who has a fetus, and then when the child is born, up until a certain age, their brain is being exposed to that fluoride, and it actually has an impact on IQ and other parts of the body as well. But why would you want your child to be impacted with IQ? Because they're getting a remineralizing agent, and that's why we decided to use hydroxyapatite. And hydroxyapatite is wonderful. It's been around forever. Well, 40, 50 years almost in Japan. In Europe, a little bit less time than that. It's been in use with medicine. It's also been used in the pharmacological world as a way to get medicine to different parts of the body. It's basically a small nano hydroxyapatite. It's a smaller version of hydroxyapatite. But as I found out a few years ago, the version that we're using in our toothpaste, which is the only version that does this, and the only version that has certification for safety and efficacy, it's more safety, but therefore there is some efficacy. It's made in Europe, and it's certified by a group of scientists in Europe. And if you look at it, and I've done this, I've looked at it under scanning electron microscopes. That's a very powerful microscope. You can see these particles. These particles look just like the particles that are in your teeth. So,
wow.
Yeah, so if you were to take a tooth, let's say somehow you were able to get hold of a tooth that has never seen toothpaste, right? Any kind of toothpaste. And you cross-section and you look at it, those little nanoparticles of calcium and phosphate and hydroxyl ions, it's kind of a little ball, a crystalline ball that's fluid in nature. It's like a snowflake almost, and has a very complex structure. And then that combines with other snowflakes, and that's what makes up our teeth. That's the same stuff that's in our toothpaste. Identical. If you look at the microscopic picture. So it's the same size. It's the same shape. It's the same chemical makeup. I mean, it is essentially what's in our teeth, and that gets dissolved in your saliva. And when your tooth needs it, there it is. It's in the saliva, and it can be pulled out of saliva, and your tooth can be rebuilt, and cavities can be reversed. Small ones can be reversed, which happens every day in your mouth. When you're eating, your teeth kind of demineralize, and then as you swish with water and restabilize the pH, your teeth are remineralizing. That's happening every single day after every meal or beverage. That is how your body is dealing with that loss of calcium to your teeth. It's trying to remineralize those teeth. Give it what it needs. Again, it's just like the oral microbiome. Just get out of the way, give it what it needs, and let the body do what it's good at, and that is fixing itself.
So basically, your toothpaste heals your teeth naturally.
It does, with natural products that are already in the tooth. And we took out, the tough part was taking out all the bad stuff. and still
Mhm.
keeping a nice gel and paste that people are used to. Taking out the emulsifiers and surfactants was difficult. But those soaps and detergents, which by the way, they're only there to make the toothpaste mix properly and stay mixed well in the tube. It's more of a manufacturing chemical, and it makes toothpaste bubble and foam. And then, of course, the marketing department got a hold of that and said, if your toothpaste doesn't foam, it's not working. Total nonsense. Okay. It's actually breaking down. And destroying, breaking apart the lipid layer, the fat layer of a cell wall, and then the contents of the cell spill out. I mean, it's killing a cell. And that's not what we need in the mouth. Again, we got to get out of the way and let nature take its course and feed it so that it can take care of itself. So that was hard to do. And our first run was a little watery at times. We put on the back of the label, mix and squeeze the tube. Our second run is much better. There's no runniness to it or you don't even have to mix it, squeezing the tube anymore. So that was very satisfying to be able to take out a very common ingredient that has been in toothpaste from day one. We don't need it. It was there for manufacturing purposes only. It's not good for our oral microbiome. We do not need soap in our mouth or detergents.
Also, we have a special discount code for our audience, Holistic, all caps 20. So, yeah.
Remember to check that out.
Yeah.
Because his product is amazing. And as you can tell by how passionate he speaks about it, it's, it's amazing. Just check it out.
It's amazing. Yeah, just go check it out.
Let's recap Dr. Mark's key points.
The mouth isn't just the largest opening. We eat things. We talk. It samples the environment. It's like smelling. The oral microbiome is different than the rest of the body. The mouth needs maintenance and health. In the world of artificial food, we need to take care of our mouth. Today, more than ever. When we eat fake food, it thickens the biofilm, destroys our teeth, and leads to inflammation and gum disease.
What happens in your mouth doesn't stay in your mouth. Your bad bugs can go all over the body and can lead to further inflammation and insulin resistance. Basically, just because it's in your mouth doesn't mean it will spread. The body is always trying to fight off bad bugs from the mouth. That's why we need to leave the oral microbiome alone. We need to stop using chemicals in our mouths to further the destruction in our bodies. Because in this world that we're living right now, our bodies are already handling enough. We need to stop using chemicals in our mouths. We need to feed the oral microbiome what it needs, like prebiotics and fiber. Adding fermented foods will also be really helpful for your mouth, and it will give the oral microbiome basically how Dr. B said, superpowers.
True.
We don't need to have cavities. It's possible. You need to eat properly and take care of your teeth. Learn to choose the oral care products. Stay away from fluoride. We need to let the oral microbiome along and let them do their job. Most importantly, check out FIG, Dr. B's and Dr. Stacy's premium fluoride-free toothpaste featuring hydroxyapatite prebiotics designed to support a healthy oral microbiome. Check it out today. Like right now. Like go right now.
Right now.
Thank you again, Dr. Mark. This was such a fun and must-needed conversation.
Well, thank you, Iman. I appreciate it. I'm glad you were here and at your age that you're interested in all of this. It's amazing. Zane, great questions. And Abdullah, thank you. Thank you for your interest in oral health. I really appreciate it.
Well, it's our pleasure.
It's our pleasure.
Mine as well.
Thank you everyone for tuning in. Until next time, I'm Zain Sari.
I'm Dula.
And I'm Iman.
Follow my family on social media, Holistic Mom D, and look out for my mom's book that came out last week, Adam's Healing Adventure, Fake Food versus Real Food, Food Label Detectives. And stay tuned for the book of the Teen Health Revolution, releasing 2025. Kids need to learn from other kids. Please download our podcast on iTunes and leave a review for other kids and families can benefit. Join us next week for another episode of The Holistic Kid Show, where kids are empowering kids. Thank you, everyone.
Thank you, everyone.
Thank you.